Well, good morning, everybody. It's 9:30. We're going to go ahead and get started. This training will be recorded, and that's because I want to make sure that anybody else that comes in and wants to be certified in this program, that they will have access to it. So we're going to go over a couple of things before we go ahead and get started. For those who have microphones, can you let me know if you're able to see my screen? Anybody that has a microphone?
Yeah, I can see it.
Okay, thank you so much. So, welcome to the Qualified Hospital Presumptive Eligibility Medical Assistance Training. My name is Kanita Snee, and I will be your trainer for today, and I am the Healthcare Program Consultant for this particular program. Before we get started, we're going to go over a couple of things. Can we go ahead and make sure everybody check their mic to make sure that they're on mute, because I don't want any distraction while we're going through the training. And we want to make sure that everybody gets the full training and everybody understands what's going on and able to hear everything that I am saying today. So just take a couple of seconds to make sure that your mic is on mute. This training will be an interactive training, meaning that I will be asking you all to participate. It's just not only me talking, but I want you all to participate as well. And that lets me know that you're understanding the material that you are receiving today. Because when you get from this training, once you pass your assessment, it will be all on you to make sure that you're making correct PE determinations. As far as lunch, your lunch will be 30 minutes today. We were going to try to take it around 12:30. It just depends on how far along in the training we are, but I'm going to try to get you all out to lunch around 12 or 12:30, and it would be for 30 minutes. We will try to take a morning break and an afternoon break. I'm not going to guarantee you that it's going to happen because we have a lot of information to go over, and I want to make sure that we use our time wisely to make sure we incorporate everything that you need to learn from 9:30 to 3:30. But I would try my best to set myself a note to try to give you a little break in the morning and afternoon, since the lunch is only 30 minutes. As far as questions, I would like to handle those at the end of each section in the training. So in the training, you will see when we begin a new section. So before we begin a new section, I will go back and ask if there are any questions. If you don't have access to a microphone, that is totally fine. We have a chat feature that you will be able to ask any questions if you have any questions. So if you have access to a mic, you could go ahead and take yourself off mute to ask your question. Or if you don't have access to a mic, you can use the chat box to ask your question. Also, when we're interacting and I ask you to participate, if you don't have access to a mic, that's fine as well. You can put your answers in the chat as well. If for some reason you need me to repeat something, please let me know. Also, if you need me to slow down, please let me know that as well. I do have my colleague on the line, Ms. Fair, and also possibly Ms. Jackson, that will be monitoring the chat box for me while I'm going through the training, because I really don't have access to it. So they will be monitoring the chat box. So if I don't see your question, they will see your question and possibly answer. If not, we will revisit or relook at those questions at the end of each section. Okay, are there any questions before we get started? Okay, let's dive right on into it. So like I said, this is the training for Qualified Hospital Presumptive Eligibility Medical Assistance Training, and I am your trainer, Kanita Sneed. So our mission at the Department of Community Health, we're trying to make sure that we provide access to affordable, quality healthcare to Georgians, and we're going to do that through effective planning, purchasing, and oversight. And of course, our purpose at the Department of Community Health, and it should be everybody's purpose, that we're trying to shape our future to make sure that Georgia becomes more healthy And we're doing that by improving access and ensuring quality to strengthen the communities that we serve. And this is the training for hospital presumptive eligibility. And you will hear me possibly say HPE or PE. So you can just know what HPE stands for is hospital presumptive eligibility, and PE stands for presumptive eligibility. So you will possibly hear me say that interchangeably, but just know that I'm talking about presumptive eligibility or hospital presumptive eligibility. So this training is going to go over all of the policies and procedures that you would need to know in order to make PE determinations at your particular hospital. So before we go ahead and get started into the bulk of the training, we're going to go over a few updates. And for new employees, this is going to be new information for you. But for our veteran staff that are on the line, this is basically updates for you. So the first update we have is our postpartum that we have extended out to our postpartum women. So these women, they were on some type of Medicaid, pregnancy Medicaid, low income Medicaid, but they were pregnant. And now that their pregnant has terminated, they will usually get 60 more days of coverage. Well, that 60-day coverage has been extended to 180 days. So they no longer get 60 days. They're now getting 180 days, which is equivalent to 6 months. And this came effective on July 1st. We are in the process of updating our applications to include that postpartum language on there. So be on the lookout for updated 94A coming your way. So of course, anytime there are updates or anything, I will send an email out to your PE coordinator who's supposed to distribute that information to you. So as soon as we have the English and the Spanish version of the updated 94A, I will be sending that information out to you, and that would be the new form that you will use. Until then, please continue to use the 94A that you have or that was provided to you in the training material. PE forms. There have been a few more updates to our PE forms. I know I had sent out an email possibly earlier in August about the PE updated forms, but we had to make another update on some forms. So I did send out an email. I think it was Monday, either Monday or Tuesday. So now you have a few more forms that have been updated. And the first one is the 632H, and we will look at what I actually updated on that form. It's not a major update. I just included the word U.S. national so that the citizenship or lawfully present immigrant question for each person. So we're just including U.S. national on that particular application. So that's really the only change that we made. And for the 634H, which is our notice of action, the approval and the denial notice. For the approval notice, I just had to update some the fillable fields. Some of them were kind of off, so I just updated those fields on the approval notice. But for the denial notice, I added the word U.S. national to that denial reason that was already listed. It says not a U.S. citizen or qualified immigrant. So I just added the word U.S. national to that particular denial reason. And I did that both in the English and Spanish version. So those two were updated on 8/30. And then for the PE manual update form, and we will look at these forms later on in the training. For the PE manual update form for the citizenship field, I added the word U.S. national on there. But you will find out if a person is a U.S. national, you're still going to pick U.S. citizen for their citizenship in GAMIS, okay? And we'll go over that later. And that was also updated on 8/30. The SSI pregnant women update form, it wasn't updated since the last time I sent it out to you, and I sent it out to you back earlier in August, either July or August, because they were effective for August 3rd. So this one we just updated to our new DCH letterhead, which we have a new commissioner. So her name is Kaylee Noggle. So that is all the forms that you should be using. Anytime we have DCH logo on there, you have to make sure that you're using the correct one. So that's why the SSI pregnant women update form was updated. and that was on 7/28. The quick guide, of course, another one that was updated on DCH letterhead. So that was updated on 7/28. And then we have a new HIPAA form, and that was updated back in January 18th of 2021. Are there any questions over the updates? Okay. So now we're going to go ahead and get started. So we're going to first look at our objectives for each participant today. So we're going to go over the definition and description of HPE. We're going to look at the requirements and responsibility as a qualified hospital. So since you are participating as a qualified hospital, there are certain requirements and responsibility that you need to make sure that you understand. And so we will look at those. For this program, of course, there are requirements that a applicant or individuals have to meet in order to be qualified for presumptive eligibility. So we're going to look at the program requirements, the eligibility requirements, and the procedure requirements. We're going to look at what aid categories are you going to be making PE determinations for. So of course, you know, for pregnant women, they can be done usually are done at the health department. But now since hospitals are able to do presumptive eligibility, you're not only going to be doing presumptive eligibility for pregnant women, you're also going to be doing it for other aid categories that we will look at. And then we're going to look at some gamma screenshots of how you enter this information into the system. So once you have done the PE determination on paper, then if that individual is approved for presumptive, because the system does not make the eligibility determination, you all have to make the eligibility determination. And so once you have made the determination and that individual has been approved, then you're going to have to make sure you enter that information into the system, because that's how the individual will be able to go out and get the particular medical services that they need once you have put the information in the system. With this program, there are performance standards that has to be met by each hospital, and we will look at that. We're going to look at what references to use. And for our new employees only, not people that have already been doing the program that are coming back for a refresher, but for people that are brand new to this program, you will have to take an assessment after this training. And you will have to pass this assessment with the 80% or higher before you start making PE determinations. And I'll give you more details at the end. So the first thing we're going to look at is we're going to define hospital presumptive eligibility. So like I was telling you earlier, before the Affordable Care Act was signed into law by President Obama, the health departments were making presumptive eligibility, but it was only for pregnant women. With this law being signed, it now allowed hospitals to start making presumptive eligibility determination. So that's how you all are called qualified hospitals. And to be a qualified hospital, of course, you have to already be participating as a Georgia Medicaid provider. Then you have to let us know that you want to be in this program, you want to do this program. So that's why you're in this training today, because this is how it starts. You come through this training, you pass an assessment. Once you pass the assessment and complete all of the necessary paperwork, then you will be certified to start making PE determinations. And the determinations that you make have to be consistent with the policies and procedures that you're going to be receiving from DCH today. So everything you need to know, you're not going to be out there just swimming on your own. Everything that you need to know is right here in this training. I give you everything you need to know. So there's no questions about if I didn't do this, if I didn't do this. I'm going to give you every single thing that you need to know today. With this program for presumptive eligibility, you'll find out that it's only for a specific period of time. So it's not like full Medicaid. They're not going to get it for a whole year and be renewed. The eligibility is renewed. Presumptive eligibility is only that temporary Medicaid coverage to give them something until, if they apply for full Medicaid, until DFACS makes a determination on their full Medicaid application. So with this program, you're going to find out that applicants are able to apply for full Medicaid as well. And so we will talk about that later on. And then a qualified hospital is one that has not been disqualified by DCH. So the definition and description of presumptive eligibility is just an expedited way, a fast way that we're trying to enroll individuals into the Georgia Medicaid program that are eligible for the program. And like I said, it's only for a specific period of time. And we're going to talk about the PE period in just a moment. And to make a correct eligibility determination, these are the factors that we have to look at. So these are the requirements that an individual must meet in order to be eligible for presumptive eligibility. So we're going to be looking at their income, and it's going to be based on its MAGI-based income, which is modified adjusted gross income. And modified adjusted gross income is just taxable income. There are some types of income that are not taxable that we do include, but majority of the income is taxable income. We're going to be looking at their tax filer status. So there is a question that you're going to be asking each applicant. Are you filing taxes or expect to be claimed as a tax dependent? And that is very important that you ask each applicant that, because that will determine their budget group. And when we look at budget group, you will see that the budget group is also going to be determining their income limit that we look at if we have to look at the income limit for them. We're going to look at their household size. Of course, they're going to have to be a U.S. citizen, national, or qualified immigrant. And then, of course, they have to be a resident of Georgia. So the first thing we're going to talk about is the PE period. And please pay close attention to this if you are a new employee, because this will be on your test. So the PE period time, we're going to talk about the PE period is the date that it starts to the date that it ends. So the PE period always starts on the date that they were approved. It's basically their application date, because you're going to find out that everything has to be done on the same day. So if somebody comes in and apply at your hospital today, that means you need to make an eligibility determination today. If you determine that individuals are eligible, then you also have to put that information into the GAMIS system as well. Because if you approve them today, but you don't actually put it into GAMIS till tomorrow, then the PE period is really not starting until tomorrow. So the PE period is not going to go back and pick up that application date when they actually did the application. If they apply for full Medicaid, they're going to have to wait till that full Medicaid application is approved, and then the full Medicaid will go back to the first of the month. So presumptive eligibility does not go back to the first of the month like full Medicaid does. So it's always best to make sure you put in your mind, if somebody applies, you got to do everything that same day in order for their claims to be paid. So the PE period starts on the date that they apply and get approved, and it ends either the following month at the end of the month, or when DFACS makes an eligibility or ineligibility determination. But for your assessment purposes, you're going to put the application date through the end of the next month. So I gave you two examples down here at the bottom. So if an applicant come in on January 26, 2021 and was approved, the PE period is going to be January 26, 2021 through February 28, 2021. And that is the date range that you will always give to your applicant. You will give them that PE period time. You're going to give them the start date to the end date. Now on the back end, their application may get processed before the time frame. So if that happens, let's say, for instance, it was a pregnant woman's application. You know, those pregnant women applications have to be completed by DFACS within 10 days. Let's say she came in today, which is September the 2nd. You put her into GAMIS. So her PE period right now stands at September 2nd, 2021 through October 31st, 2021. Well, when we send that application to DFACS, let's say DFACS approves it tomorrow. Well, if DFACS approves it tomorrow and it comes over to the system, then her coverage is going to stop for presumptive and the full Medicaid is going to pick up. Sometimes it happens and sometimes it doesn't happen. But for your purposes, the PE period is always the application date through the end of the following month. And then the next example is someone applies on February 1st, 2021. The PE period is going to be February 1st, 2021 through March 31st, 2021. And you have to make sure when you're doing your assessment, you give me both dates. Don't just give me the application date or don't just give me the following month. You have to give me both dates in order for it to be correct. Are there any questions over the PE period?
You have a hand raised, Kanita. Sharon Rivera.
Okay.
And she's asking, where do we put both dates?
This is just for PE purposes. So if you are a new employee, this is very important for you because this is going to be on your assessment. But this is for knowledge for you when you're telling your applicant their PE period time, because once they have been approved, then there's certain information you should be providing them. And one of them is that you should be providing them with the PE period time. It's nowhere to put it. It's just something that you have to let them know when it starts and when it ends.
And you have another question from Xavier Rivers. His hand is raised.
Okay. Go ahead, Xavier, if you have access to a mic. Did he type it in the chat?
No, it looks like he's trying to come off mute, but it's not letting him. I mean, well, he's coming off mute, but I don't think we can hear anything. Can you type it in the chat? It said, never mind.
Okay. Any more questions? Okay. So now we're going to get into the requirements and responsibility as a qualified hospital participating in this program. So the first one is your interest to participate in this program. So that's why you're here today. The second one is signing the MOU. You all don't have to worry about it because each of your hospitals are already participating. It's just that you're coming on as a new employee or you're already working. You're coming here for a refresher, so you don't have to worry about the second one. The third one is for my new employees. So you will have to sign a qualified hospital provider agreement and statement of completion training form. I did send you this information in the training material that you received on Tuesday. So if you go back through that email, please make sure you're printing out these 2 copies. You need to make sure that you are reading the agreement. You're going to sign it. And then for the statement of completion form, you're going to fill that out completely. You're going to initial beside all of the training material that you did receive. You're going to sign off on it, and then you're also going to give it to your PE coordinator or your supervisor to sign off on it as well. So don't send me the completion form without both of you all's signature. And that is for new employees. You must make sure that you make correct PE determinations. So you're going to get all the information you need today in order to do that correctly. This is for my PE coordinators. I think I have a couple on the line, but one thing that we're going to have to go back to doing is to make sure that we're keeping a list of all the people that are authorized to do presumptive eligibility. And I know I kind of slacked off on this because it's just been a lot going on. So possibly starting in 2022, you will be seeing me asking you for that list more often. And that's because I'm not keeping a a grasp of all the people that are authorized to do this program, because I know people leave, people come, and all of that. So we're just going to have to make sure that we put that back on our radar to make sure that we're keeping up with the list of all people that are authorized to do presumptive eligibility at your particular hospital. Complete PE training and any additional training. So for new employees, I told you earlier, after the training, there will be an assessment that you would need to take for the first time and pass with the 80% or higher. Any other additional trainings, there will be a performance standard process that I told you all about that you will have to make sure that your hospital is complying with. And if not, if I go through applications and I see that you're making, a lot of mistakes, I'll try to coach you along and try to tell you what your mistakes are. But if I feel like you're just doing the numerous number of errors and you're doing the errors totally every month, consistently every month, then you will have additional training. The only other training that I usually have after this training is like a refresher trainer, and that's required for everybody that is doing presumptive eligibility determination. And we usually have that only once a year, and it would be a training just like this. It's nothing that you will have to come travel to. So it will be on the computer as well. So that training, it's a little bit more shorter. It's usually like a couple of hours or so, but we just try to go over things that I've seen over the past few years that I need to address to everybody. Also, any updates that I haven't given to you or updates that I have given to you, I just make sure that I reiterate those. We go over those, and then that is a good opportunity for you to ask me any questions that you have. Cooperate with PE monitoring and quality control and meet performance standards. So we're going to look at that audit process. So we will look at that towards the end of the training. Develop a corrective action plan if needed. So that goes along with the last bullet point that you see right here in red. So for the federal regulations, as a part of this program is specifically because the MOU is the agreement between the actual hospital and DCH. And we know that some hospitals do contract out with third-party vendors with some of their services. But for this program, it's letting you know that you all cannot delegate any third-party vendors to make PE determinations. You all have to do that. So you have to be an actual hospital staff paid by the actual hospital making PE determinations. So if you work for a third-party vendor, you should not be making PE determinations. That should be actually done by the hospital staff. Now, if you work for a third-party contractor, you can assist the hospital staff by helping them like gather information, making copies, helping the applicant fill out the information. But when it comes to making the PE determination and also entering the determination into GAMIS once it has been approved, all that has to be done by the actual hospital staff. Are there any questions over the requirements and the responsibilities? Okay. So how can you be disqualified from doing this program? So if the hospital is not making or is not capable of making correct PE determinations in accordance to the policies and procedures that you're going to receive today, you can be disqualified. If you're not meeting DCH's standards, and then once we have identified an issue with the hospital, we of course bring that to your attention and just ask you how you're going to correct that action going forward. And so sometimes it may require a corrective action plan like we've seen in the previous slide. So we will make sure that we bring that information to your attention so the issue can be corrected. And we do provide you with additional training just to make sure that you're understanding everything about this program. But after that additional training and you still not taking the correct actions towards that issue, then you can be disqualified from participating in this program. We haven't had that to happen, and I don't expect to have it happen because it is a good program for both you all and DCH, and also it helps our citizens of Georgia to get the access to medical coverage that they need. So now we're going to get into our program requirements. We're going to look at the aid categories that you're going to be making the presumptive eligibility determinations for. We're going to be looking at the time period, meaning how often can someone apply for this program. We're also going to be looking at gamuts and screenshots of gamuts. And then we're also going to be looking at all the applications and forms that you're going to need to make sure that you understand, because those are the forms and applications that you're going to be filling out for each applicant. And also that information will be sent to DCH, as we call it, a PE packet. And some of those forms that is part of your audit process as well. That is what you will be audited on. So we will be looking at all of that information. So the first thing we're going to look at is our aid categories. So what aid categories are we going to be making presumptive eligibility determinations for? So we have 4 aid categories that we're going to be looking at, and these 4 aid categories consist of our family Medicaid aid categories. So first off, you have your parent caretaker with children under the age of 19, and we're going to go through each one of those in just a moment. Then you have your children under the age of 19. Of course, you have your pregnant women, and then you have your former foster care. So these are people that were in foster care, but they aged out of the system at the age of 18 or older, and they have not reached their 26th birthday. But we'll go over those in just a moment. So the first one we're going to look at is our parent caretaker with children under the age of 19. So this is specifically for parents or caretakers, and they have eligible children under the age of 19. Now, if you're going to be approving the parent or the caretaker, you have to make sure that you are approving the children under this aid category as well. The only time you can approve a parent or a caretaker without the children is that once you screen in gamuts, if they have children that are already receiving Medicaid, then yes, the parent or the caretaker can be eligible for presumptive eligibility. But you have to make sure that at least one of their children are already on Medicaid, or either you are approving the children with them up under Medicaid. And if the parent or the caretaker is eligible, that means the children should be eligible for this aid category. You will see that, well, you won't see, but I've been seeing that people have been approving the parent or the caretaker for this particular aid category, but then putting the children under another aid category, which is the children under 19, and that is incorrect. All of them have to go up under the correct aid category if they are eligible for this aid category. So to be eligible for this aid category, we're going to be looking at their tax filer or non-tax filer status. So that means that's going to determine their budget group. So if they're supposed to be in this budget group, they're going to be in the budget group, and we're going to count their income. So we're going to be looking at that in just a moment. If they are a tax dependent, we're going to look at to see if that tax dependent actually makes an exception per the ACA, which is the Affordable Care Act. Of course, they have to meet the income limit. They have to be a resident of Georgia, and they have to be a U.S. citizen, national, or a qualified immigrant. And we will look at how do you determine if an individual is considered a qualified immigrant. So those are the eligibility criteria for the aid category parent caretaker with children under the age of 19. The second aid category is specifically for children under the age of 19. So if they're not eligible for a parent caretaker, the children are not eligible for parent caretaker, then you can look at just the children for children under the age of 19 aid category. And their eligibility criteria is the same criteria except for their parents won't be with them up under this particular aid category. It'll just be the children. So they have to have a tax filer, non-tax filer status. Tax dependent, we have to see if they meet an exception. Of course, they have to meet the income limit, have to be a Georgia resident, a U.S. citizen, national, or a qualified immigrant. Your next particular aid category is your pregnant women. So the eligibility criteria is almost the same as the first two aid categories that we went over. But for this particular aid category, of course, they have to be pregnant. If she's had the baby or she's in her postpartum period, she would not be eligible for presumptive eligibility. She would have to do a full Medicaid application at that point. So the individual has to be pregnant. We do not have to verify her pregnancy. So if she just tells us that she's pregnant, we have to accept her statement and go through all the other eligibility criteria to see if she would meet the criteria for presumptive eligibility. And she can only be approved for presumptive eligibility once per pregnancy. So it has to be a brand new pregnancy in order for her to be eligible for presumptive again once she has been approved for that one pregnancy. So in order for her to come back and have another determination, she has to have at least had that baby or the pregnancy has terminated and she's pregnant again before we can make another eligibility determination. And then the last aid category is your former foster care. So like I said, these are for individuals who were in the foster care and they age out of the age of 18 or older and they not have reached their 26th birthday, meaning they have not reached the age 26 yet. So their eligibility criteria, of course, they have to be a Georgia resident, a U.S. citizen, national, or qualified immigrants. And for them, we do not look at their income for them. So you will see on your income limit chart, there is no column for former foster care. There is no income limit for them. So we don't have to look at any income for them. And then also we don't have to worry about the tax filer, non-tax filer status with them as well. So this particular individual, if they're a former foster care, they're going to always be in a budget group by themselves. So it's always a budget group of one. So if they have other people in their household or their budget group that needs medical assistance, then we're going to look at them for another aid category and put that particular person that's eligible for former foster care. We're going to put them in former foster care, and then the other individuals we will look at to see if they're eligible for another aid category. So those are the eligibility criteria for your children, parent caretaker with children under the age of 19, children under the age of 19, pregnant women, and former foster care. So those are the 4 aid categories that you're going to be determining somebody's presumptive eligibility for. Are there any questions?
You have a hand raised. It was Miss Sharon.
Okay, Sharon, take yourself off mute if you have access to a mic.
Okay, she says it looks like her mic is not working.
Okay, go ahead and type it in the chat.
Okay, my question is if a pregnant woman meets criteria also for parent caretaker. I guess she's asking which COA would you choose? Yeah. Which category should we check her in?
Okay. So if an individual, she's eligible for parent caretaker and also pregnant women, I will put her in the parent caretaker with the other children, because when you see also with Gateway, excuse me, once their application goes over to DFACS and DFACS make an eligibility determination, Medicaid is based on a hierarchy. So parent caretaker is at the top of that hierarchy, and parent and pregnant women is towards the bottom. So I would pick the parent caretaker if she's eligible for parent caretaker. Any
Okay,
other
thank
questions?
you. No new questions are in the chat.
Okay, thank you. So how often can someone apply for presumptive eligibility once they have been approved? So we're talking about people that have been approved. We're not talking about people that were denied for PE. We're talking about people that you approved them for PE or somebody approved them for PE. So for our pregnant women, we went over that. We said it could only be done once per pregnancy. So they have to be pregnant with a new pregnancy in order to be eligible for presumptive again. For your other aid categories, your parent caretaker with children under the age of 19, your children under the age of 19, in the form of foster care, and then also women's health. Women's health is another training, and that is another training, a separate training from this training. So if your hospital is eligible or is interested in that program, then you will reach out to Ms. Fair, the one that is handling the chat box for me. But for those aid categories, it could only be once every 2 years. So if somebody applied today, which is September 2nd, and they were approved, so their eligibility or their PE period is going to go from September 2nd through October 31st, so that of 2021. So that means that they cannot come back and have an eligibility determination until November 1st, 2023. And so you will find out on the gamut screenshot that we see, we really not going to know, because most of the time people are not going to be honest with you and let you know that they've already had a determination for PE before. So what you will have to do is to just go through the process, and once you try to add that person to the computer, if the computer recognizes that they've already had a presumptive eligibility within the last 2 years, then it will prompt you with that error message, and that's when you will have to back out of it and deny them because they're not going to be eligible for it. But for pregnant women, once per pregnancy, and for all the other aid categories, it's once every 2 years. So people that are incarcerated, if they are trying to apply for presumptive eligibility, they're not going to be eligible. So you will let them know. I'm not sure if you all encounter this or not. So if someone is at your hospital and they're still incarcerated, they are not going to be eligible for this program. So you will let them know that they're not eligible for the program, but they can apply once they have been released. So now we're going to get into the coverage part of it. What does presumptive eligibility actually covers? It actually covers everything the full Medicaid covers. So whatever aid category they're up under, whatever the full Medicaid will cover, that's exactly what presumptive eligibility is going to cover. I know you probably have some providers that don't like taking individual with presumptive eligibility. I'm not sure why, because it works just like full Medicaid. The only difference is that presumptive eligibility only lasts for a certain period of time. But as far as billing and claims and all of that, it pays for everything full Medicaid pays for that particular aid category. But for pregnant women, the only thing that it does pay for is just their prenatal care and their pharmacy services. So it's not going to pay for inpatient hospital stay, and it's not going to pay for labor and delivery. So for pregnant women, it's only going to pay for prenatal care and pharmacy services. So once an individual has been approved for presumptive eligibility, they're able to go and get the medical services that they need right then and there. So they can be approved with you now, and then 30 minutes later, they go see their doctor, or either if they are in that particular hospital, they're in the ER, whatever, they can get their services that they need. The only thing that doesn't happen right away is for prescriptions. So for prescriptions, when an individual has been approved, you would need to let all of your applicant know at the time of approval that it's going to take at least 24 to 48 hours before they're able to go and get their prescriptions filled. And that's because the information has to be transferred from our system over to our third-party vendor, our pharmacy benefit manager, which is Optum. They have to get that information on that particular member. So that's why it's going to take at least 24 to 48 hours. And so once you have informed them of that, if they tell you that it is an emergency and that they really need their prescriptions, they can't go without, they can't wait those 24 to 48 hours. Then in that particular situation, there is a process that you would need to follow. What you would do is just to send an email to DCH, and you're going to send it to this particular email address that is listed on your screen, and that is pecorrections@dch.ga.gov. And make sure you're sending the request the same day that you do the approval, because if you send it like the next day, then it's already in the process of being updated in Optima. And I'm not sure that we're going to be able to go ahead and, it may we're probably not going to be able to go in and update that information. So make sure you're sending the request the same day of the approval. And all you have to do is just send us the member's first name and last name and their ID number. And you just put, can you update pharmacy for this member? Or you could just put emergency pharmacy update, however you want to put it. But just let us know that you're requesting a pharmacy update. Okay, for our pregnant women, they can get dental coverage while they are pregnant. The only thing that they would need to do is to have a form filled out or completed by their doctor to verify their pregnancy, and it's called attestation of pregnancy. So on the next slide, I did provide you this form in your training email. So if someone is a pregnant woman is looking for dental services, then you would need to provide her with a copy of this and let her know that she needs to take this to her doctor and have it completed. And then once it's completed, she will provide that information to her dentist. Are there any questions before we continue on?
Querida, this is Olga. Can you hear me?
Yes.
Yeah. Thank you so much for the data and for the help that you always provide to us. I really appreciate that. I had a question. I had a particular case with this mom pay for her prescription. It was about $900. I activated the PE, and this was a child that needed the prescription. I send mom back to the pharmacy and I say, I'm not sure what happened because it has been past the 24 hours. And you say now there's up to 48 hours also. And I guess she got the money back. But what we would do in these cases when mom already paid to the pharmacy, and sometimes it's a lot of money, $900. We still have to send the email to the correction, to the PE correction address that you give to us for the mom to receive the money back, or that's just between the mom and the pharmacy? How that will work?
That's actually going to be between the mom and the pharmacy, because Medicaid doesn't reimburse members back directly. So, and that's in the same instance as the doctor. If the doctor said that they will see her or him or her until their Medicaid gets paid, or either she pay out of pocket, that's going to be like an agreement between the provider and the actual member, because Medicaid does not reimburse members directly. So if she pays out of pocket and her coverage now shows, if the pharmacy wants to reimburse her, that's fine, but Medicaid is not going to reimburse members back directly.
Okay, thank you. That
You're
answers my
welcome.
question.
Okay. Are there any questions in the chat, Teresa?
Yeah, we have one question. It says, I have issues with pediatricians and pharmacies declining PE.
Yeah, that's just probably a training consideration as far as providers. If you're having that issues, the only thing I can tell you at this point is just to send me an email what the issue is. And I will have to work with my colleague that are on the Medicaid provider side and have them to actually reach out to that particular provider to educate them on this type of service and let them know that it's going to be fee for service. That these particular individuals are not going to be in the CMO. So if you send me that email directly, then we will try to handle it on our side to make sure that we're educating the providers on presumptive eligibility. Because like I said, it's just like full Medicaid. The only difference is just it only lasts for a certain period of time, but it's just like full Medicaid. Are there any other questions?
The
Yes,
chat is
Kenita, this is Olga. I have one more question.
Okay.
How long it will take for once you do the activation for the parents to receive the actual card?
The Medicaid card?
Yes.
So once they have been approved for presumptive eligibility, do they always get a Medicaid card as long as you put them into GAMIS if they already don't have a card? If they already have one, then they continue to use that card because you're about to find out in just a moment, once they have been in the GAMIS system and they have an ID number attached to them, that ID number continues with them, for a lifetime. So once they have been approved for presumptive eligibility, a card goes out and it usually takes 7 to 10 business days for them to receive it. They just have to make sure that they are giving us the correct mailing address.
Thank you.
You're welcome.
We have another question in the chat or a statement that they were stating that they have an issue with some dentists not accepting the PE for children.
Like I said again, please send me those emails directly, and we would just have to reach out to those particular providers to see what the issue is. But we'll just have to handle those on a case-by-case basis. Any other questions?
Just had one pop up. Can a letterhead from Medicaid be enough to prove the patient is pregnant, or does the form need to be completed? Oh, excuse me, from the MD be enough for the prove the patient is pregnant, or does the form need to be completed?
They would have to actually have that particular form according to the policies for dental services that I looked up. They have to have that particular form. So you would have to provide them with that 635. Are there any other questions?
Chat is clear.
Thank you. Okay, so the first thing we're going to do before you start any presumptive eligibility applications, the first thing you always have to make sure you do is to screen each individual into GAMIS. And that is because you're looking to see if they're already on Medicaid or not, because that would determine what particular step you would need to take. Because based off of what GAMIS shows you, there are particular procedures that you would need to use based off what you see in GAMIS. Also, it also allows you to get their ID number if they have been known to the system, otherwise had Medicaid in the state of Georgia before. So those are the reasons why we are screening into GAMIS, because if they're already active on full Medicaid, You don't have to go through the process of doing a PE application. That is paper or another application you can save for somebody else. And also it doesn't waste your time of getting all that information when you really don't need it because they're already active. So we're going to be looking at certain procedures that you would need to take based off of what the system provides you with. So the first step you always need to do is to make sure that you're screening each individual into gametes first. And we will look at screenshots of how you actually screen for an individual. If an applicant is showing active on full Medicaid, you do not have to complete a PE medical assistance application. So in that instance, you would just let them know you're already active on Medicaid. You know, if you have any changes or anything you need to report, then you need to report that information to DFACS. So we're going to skip ahead to slide 26 and come back. 27, I mean. So for full Medicaid, these are the list of the full Medicaid aid category that someone can be eligible for. So if you screen them into gametes and it shows you active, and it'll tell you what aid category they're active on. So if you see that they're active on one of these aid categories, you will let them know that they're already active and that they need to report any type of changes that they have to DFACS. So you would not complete a PE application on these individuals. So let's go back. So if you screen an individual and it shows that they're active on Planning for Healthy Babies, that is what P4HB stands for, Planning for Healthy Babies. And the A category you're looking for is 180, which is inter-pregnancy care, or 181, which is your family planning. So if you see that they're active on either one of these two A categories for Planning for Healthy Babies, then these individuals, you're going to treat them as if they don't have Medicaid, because Planning for Healthy Babies is not for Medicaid. So you're going to treat them as if they don't have Medicaid, and you're going to let them complete the PE process. So that means you're going to do an application on them, go through the whole process, make an eligibility determination. If they are eligible, then you're going to add them to gametes. And then another thing you will need to do after you add them to gametes is that you're going to have to notify DCH that we need to terminate that Planning for Healthy Baby coverage now, since this individual is now active up under A category, up under hospital presumptive eligibility. So to notify DCH, you're going to be completing what we call a PE manual update form. Don't worry about this process right now. We're going to get into the whole process later on. You're going to complete a PE manual update form, and you're going to send that to DCH, and it's the same address that you sent earlier, pecorrections@dch.ga.gov. You will send that form along with the 632H, which is called our PE application, and also, if applicable, the attachment A. And the attachment A is just a telephonic signature process that we're going to look at later on. So you're going to send that information to DCH, and that will let DCH know, hey, this individual's P4HB case needs to be terminated. So again, if they're on P4HB 180 or 181, please follow this particular process. And I get this question all the time. You may think it's simple. To some of y'all, it may be simple. To some, is not. But I get this question all the time. Kanita, what do I do? This lady is on Planning for Healthy Babies. What do I do? And this is the particular procedure that you will need to follow. So if you have an individual that is pregnant, and if you screen this individual, they are active on Women's Health, which is BCC, breast and cervical cancer, then you're going to let this individual know that they need to report their pregnancy either to their caseworker, they should know who their caseworker is, or they can go online and report it at Gateway, which is www.gateway.ga.gov. Or if you like, you can send the email to the Women's Health email address, which is womenshealth@dhs www.ga.gov. Either one of those, they can report it to their caseworker, report it online, or either you can send an email. Just let them know. If you send an email, just give the member's name and the ID number and like the phone, the contact number for that particular individual. Let them know that this lady is pregnant and will somebody reach out to her. She's trying to report her pregnancy. Will someone reach out to her? And someone will get that email and reach out to that particular individual. If the individual is on SSI, if you screen the individual and it shows that they're active on SSI, then you will need to complete a SSI pregnant women update form. If we go to slide 25, you will see it right here. This is the SSI pregnant women update form. So for these particular individuals, you're not going to complete a PE application on them. You're just going to fill this form out and fill out each field that it is asking for, and make sure you print your information down at the bottom. And you're going to send just this form to DCH, and the email address is listed on the form. So you would just send this form to DCH. And what we would do is we would go into the GAMIT system to verify this person is actually on SSI. If they are, then we're going to update their pregnancy information. We're not going to transfer them or close out their SSI Medicaid and transfer them to pregnant women Medicaid or another aid category. They're going to stay on SSI Medicaid. All we're going to do is to update their pregnancy information in the system. Back. If you screen an individual and it shows they're active on QMB or SLMB, these are our Medicare Savings Program. So if they're active on QMB or SLMB, you're going to treat them again like they don't have Medicaid. So you're going to treat them as if they don't have Medicaid, and you're going to go through and allow them to apply for PE, and you're going to go through the PE process. Once you go through the PE process, if they are determined eligible, then you're going to add them to GAMIS. And then, of course, you're going to send your PE packet to DCH at this particular email address. So please get this email address in your head, because this is where you're going to be sending mostly everything that you do. You're going to be sending to this particular email address. And in the body of the email, you can just indicate that this applicant is active on QTrack also. But if they are QMB and SLMB, just follow the normal process as usual. Send your packet to DCH, and then in the body of the email, just put that the individual is active on QTrack also. Then if you have an individual that is active on QI1, this is another Medicare Savings program. So if the individual is active on QI1, these individuals cannot be active on another aid category with QI1. So for these particular individuals, we're not going to have them apply for presumptive eligibility. We're going to have them apply just for full Medicaid. So the only thing you will need to do is to give them the 94A form. Have them to complete just the 94A. Don't do a presumptive application on them. Just have them complete the 94A. And then you're just going to send that form to DCH. And then the subject line, just put QI1/pregnant applicant. So we'll know that this individual is pregnant, but they're active on QI1. And so we will send that application to DFAS to go ahead and make a full determination. Another one is members that are active on inmate Medicaid. So these particular individuals, they're mostly released from being incarcerated, and now they're trying to apply for presumptive. So these individuals have to have been released. So if they have been released, you're just going to ask them, have you been released? If so, what was your release date? So you're going to complete the PE process as normal to make a determination. If they are eligible, you will not add the PE to GAMIS. So that's the only thing you're not going to do. You're not going to add the PE to GAMIS. Instead, what you're going to do is you're going to send me directly the PE application, which is the 632H. and the release date that they told you, that the individual told you. Send it directly to me. And then what I would do is I would verify that that actual person has been released. If they have, then I would add the PE to GAMIS and reach out to the member to let them know that. And then, of course, you're going to send your PE packet to DCH. And we will talk about what the PE packet. When you're sending information either directly to me or to the PE correction email, and it has PHI information, PII information, any identifying information on a particular individual, please always make sure that you are sending this securely. If you have to encrypt it, whatever your IT department has for your security purposes, please make sure you're sending your email securely. So if an individual is active on another type of A category that we did not go over, but they are listed in that chart that's on slide 27, you're going to refer them back to DFAC. So they can either go online, they can call the 1877 number. Some offices may be open, but I think most of them are not. So their options are either to go online or call the 1877 number to report that they're pregnant or any information that they need to report to DFACS. So are there any questions over the particular steps that you would use based off of what GAMIS shows you? So if they're active on P4HB 180, 181, you need to follow the step that we just went over. If they're pregnant and they're active on women's health, there's a particular procedure you need to follow. If they're active on SSI, you just fill out the SSI Pregnant Women Update form. If they're active on QMB or SLMB, you're going to complete the process as normal and then put it in the body of the email, active on QTrack also. If they're active on QI1, then you're just going to have them complete just the 94A and send that to the PE correction box and say QI1/pregnant applicant. If they are receiving, they're active on inmate Medicaid, complete the normal process as usual, and then send me the 632H with the release date. Then I will add the PE to GAMIS if the release date has been verified. Are there any questions?
We have a hand raised, Janet Sperlin.
Okay, Janet, you have a mic. You can take yourself off mute.
Okay, she put it in the chat. It says, after you screen the newborn or foster care under 30 days in GAMIS and no Medicaid is found, can I generate PE without documentation, just base demographic information at patients or PT's hospital face sheet?
I'm sorry, read that out again.
Okay, after screened, newborn/foster care under 30 days in GAMIS and no Medicaid found, can I generate a PE without documentation, just base demographic information at the PT's hospital face sheet?
Okay, Janet, let me take a stab at this. I'm not sure exactly what you're trying to say, but the first thing, like I said, you always do is you screen an individual into GAMIS first. So whatever GAMIS tells you, if it shows that they're inactive, you can go ahead and do a PE application on them. Even if people come in and tell you that, well, I applied online on Gateway. If we don't have that information in GAMIS yet, that means that they're inactive right now. So that means that you can go ahead and do a PE application on them. If GAMIS shows you they're active, you need to verify to see what A category they're active up under. Based off of what A category they're active up under, then you need to follow these particular steps that I've just given you, or either refer them back to DFAS. But if they're inactive or on P4HB or QMB or SLMB, then they are eligible to apply for presumptive eligibility, also inmate. So if that's not what you're looking for, can you kind of clarify your question, Janet?
You're saying even if the baby is in foster care?
So she's saying that a newborn is in foster care, and then GAMIS is showing that no Medicaid is found. Like I said, if that pregnant woman is coming to apply for presumptive for her baby, um, and you screen that baby and that baby is not active in GAMIS, you can go ahead and do that presumptive eligibility. Once the DFACS get the full Medicaid eligibility application, then DFACS will make a determination on the full Medicaid side. And then if DFACS has that information about the child being in foster care, then the child will go possibly up under another type of aid category. It may be newborn or it may be foster care. It just depends. But for you, for a presumptive reason, if that individual is not shown active in GAMIS, you can complete a PE application.
So, okay, thanks.
Are there any other questions?
Chat is clear.
Okay, thank you. It is 10:41. We're going to stop right here and take a 10-minute break. So come back at 10:51. Okay, everyone, it's 10:51, so we're going to continue on. Before we continue on, I just want to ask a few questions. I just want to make sure that you all are grasping the information that you're receiving today, and this is especially for my new employees, but my veteran employees, please participate as well. Can I get someone to let me know what is the first thing you need to do before you start a PE application? If you have access to a mic, please take yourself off mute or either type it in the chat. What is the first thing you would need to do before you start a PE application?
Check GAMI and see if they had active Medicaid.
Okay, is this Olga?
Yes.
Thank you, Olga. Yes, that is correct. That's the first thing you need to do is to check that individual into GAMIS, and that's because we're trying to make sure that we're getting the ID number if they're already known to the system, and to see what information GAMIS is showing us if they're active or inactive. If you screen the individual and you see that they are pregnant, she's trying to apply for PE, but then when you screen that individual, it shows that she's on SSI. What step will we take if an individual is pregnant and active on SSI? Anybody that has access to a mic, or type it in the chat.
Anita, this is Olga. Oh,
no, go ahead.
We do not, we do not activate an SSI. We complete the form and send it to you.
If an individual is pregnant and they're active on SSI, when you screen them, the individual is showing active on SSI, what process you would need to take? And you're on the right step, Olga. They're active on SSI. What step will we need to take?
You have some answers in the chat as they complete the pregnant women's update form.
Yes, it's called SSI Pregnant Women Update Form. Once you complete that, that's the only form you will need to complete. And once you complete that, you send it to DCH and we will update that information. If you screen the individual and they're active on QMB or SLMB, would you do a PE applications on these individuals? They're pregnant and they're active on QMB or SLMB. Would you complete a PE application on these particular individuals? Yes or no?
Yes.
Yes, that is correct. You would complete a PE application on individuals that are active on QMB or SLMB. Remember, you complete the PE process as normal, and then when you're sending your PE packet to DCH, just put in there, you know, Q track or individual active on Q track also. Okay. I think you all pretty much got it, but if you have any questions, please feel free to stop us or either put it in the chat. So we're going to continue on where we stopped at, where we're going to pick up off at our forms. So these are a list of really all the forms that you will be utilizing when you are making a determination for an individual that is trying to apply for PE. So these are the list of all of the forms. You need to make sure, if you are a new employee, that you familiarize yourself with the form number and the form name. Because sometimes when if I have to send you an email about anything, I may use the form number or I may use the form name. So if I put either one in the email, you need to make sure, or whenever you talk to me, you need to make sure you know exactly what I'm talking about. So that's why I listed it right here for you. But on each form, the form name, of course, is going to be at the top of each form. And then if you look in the bottom left-hand corner, you will see the form number along with the revision date. So we're going to look at all of these particular forms. And these are the revisions date that I have listed. So you can make sure that you're checking yourself before you get started and you go back to the office. Make sure you're checking all of your forms to make sure you have the latest version based off the revisions date that you see here. So the first form that you're always going to use when someone is applying for presumptive eligibility is our PE application or HPE application. And this is the form 632H, the HPE application. So we're going to go over later on of how to fill this form out completely. And then we also have some examples towards the end of the training where we're going to be filling out some of these applications so you can make sure you're comfortable in filling out applications when you go back to your particular office. So this is the PE application, the HPE application 632H. You have a choice to type on this. It is in fillable form, so you're able to type on it. I prefer everyone to type this information out because I know a lot of times we're in a hurry and we're trying to write this information down and you're not realizing that your handwriting is not that neat when we're rushing. So if you can type, by all means, I prefer you to type this information out. But if you can't type it, you're going to have to make sure that you're writing clearly where that I can see the information, because this is one of the information that you will be audited on. And this form, you need to fill this out because you will be audited on this particular form. Your applicant does not need to fill this form out. You need to interview the applicant, so you will be able to fill this form out. And you're going to see that what I updated on this right here is this part right here for especially for our veteran workers. So this part right here has changed. The only thing that's changed is that we added the word U.S. national in this particular column right here. So they're going to be either U.S. citizen, U.S. national, or lawfully present immigrant. And then also in the sworn statement of applicant, we added U.S. national right up in here. So that's the only thing that has changed. But the revision date is August 30th, 2021. There is a second page to this form, but you're not going to always use the second page. The only time you need to use the second page is if there's more people in the household that cannot fit on page one. So let's say, for instance, you had a budget group of, let's say, 7. All 7 people cannot fit on page one. So you're going to put the first 4 or 5 people on page one, and then the remaining individuals on this page. You're not going to recopy what you put on page one over here. You're only going to put the remaining people on page 2. So this is the 632H, your HPE application. The next form is the notice of action, your 634H. You have an approval notice, which is on your left-hand side right here. And then you have your denial notice, which is on the right side here. So each time an individual or individuals have a determination made for presumptive eligibility, they're going to be either approved or denied. And based off of that, you're going to have to give them the notice in written. You're also going to tell them verbally, but we also have to give them written notice of what the decision was. So if they were approved, you're going to give them an approval notice. If they were denied, you're going to give them a denial notice. And you're going to give them approval and a denial notice for each individual that apply for presumptive eligibility. So if they had 5 people in their household and all 5 people were applying and all 5 people were approved, then all 5 people should have an approval notice. If 4 people were approved and 1 person was denied, you're going to give them 4 approval notice and 1 denial notice. So that's for each individual. So this is the 634H, your notice of action, approval or denial. The next one. Hold on just a moment. The next one is the 5460, which is your HIPAA. And this was last revised on January 18, 2021. So what you're going to do is there are like 5 or 6 pages, depending on if you're using an English or Spanish version. The only copy or the only page you need to keep is the signature page. All the rest of the pages should be going to your particular applicant, and you just have to give one per household. So you're going to be given these parts to your applicant, and then you're going to keep the last page. If the individual is in the office with you, you're doing the interview face-to-face, then the applicant is going to sign, date, and print their name, and you're going to keep it. But you're going to find out if you're doing this over the phone, meaning the applicant is not there with you, then instead of them signing it, all you're going to do is write on here, mail to applicant, or that you emailed it to the applicant. So we shouldn't see a signature or anything on here. All we should see is mail to the applicant or email to the applicant based on how you sent them the information. And we will look at that later on in the telephonic signature process. Again, this is the 5460, your HIPAA page. The next one is the 94A and the applicable attachment. So this is the 94A. This is just the cover page because it's like 8 pages long. So I didn't put all 8 pages on the screen, but this is just the cover page of the 94A. So when the individual is applying for presumptive eligibility, you're also going to ask them if they would like to apply for full Medicaid. Because on the 632H, there is a question on there that you're going to have to check either yes or no that the applicant filled out the 94A, which is the full application. So when they're applying, you're going to have to ask them if they want to apply for full Medicaid. And if they do, you're going to give them the 94A, and they need to be completing the 94A there with you. So once you have done the presumptive part of it, you're going to be sending this 94A with your other information to DCH. So if they want to apply for full Medicaid, you need to have them to fill out this 94A. Now, the exception to this is our pregnant women. So if you have someone that is pregnant and that apply for presumptive, then they have to fill out the 94A. We don't ask them if they want to. They have to fill it out. But for everybody else, you can ask them if they want to apply for full Medicaid. Attachment A for this application, if they have other health insurance, like other private health insurance that they pay for, and it's through a job. Let's just say, for instance, I have Kaiser with the state of Georgia. And if I'm applying for Medicaid and I have Kaiser, I will complete this form to give that information. So they will be completing attachment A. Attachment B is if they are an American Indian or Alaska Native, they will fill out attachment B. Attachment C, if they want to appoint someone as their authorized representative, this would need to be completed. Or if someone is assisting them with completing this application, they need to fill out attachment C. So again, this is the 94A. If someone is wants to apply for full Medicaid, exception is the pregnant women, they're required to complete this particular application. And for you all, I will highly recommend that while you're gathering the information and you're filling out the PE part of it, the 632H and all the other forms, I would suggest that you give the 94A to your applicant right then and there if you're not doing it over the phone. If they're there in the office with you, go ahead and give them the 94A if they want to apply, and they can be filling that out while you're doing the 632H and everything else and making the eligibility determination for PE. So therefore, when you get completed with the PE process, they're completed with the 94A. You don't have to wait on them. And that way you can have everything done together. Now, I know I'm probably going to get this question about verification. What if they want us to hold the application and wait for verification to come in? You have 5 business days to provide a PE packet to DCH once you have done the presumptive eligibility. We don't really want you to hold applications because if DFACS needs any type of verification, DFACS will reach out to that particular member and let them know what information that they need, because a lot of things DFACS can verify via interface. So we don't know exactly what DFACS needs and what DFACS doesn't need. That's why I really don't want you all to just sit there and hold these applications. Go ahead and send them over. Yeah, it may speed up the process. Yeah, it may not speed up the process if DFACS has the application, the verification. But like I said, DFACS has access to more information. So if they need to verify something, that's what they do first. DFACS reaches out through the interfaces to verify information first before they request the information from the client. So therefore, I will highly suggest that you really not hold these applications, but you have at least 5 business days from the date that you've done the application to send it to DCH, okay? But if they provide you the verification right then and there, of course, make a copy of it and send it along as part of your PE packet. The next form is the DMA 285. So if they have other health insurance, whether it's through a job or not, they need to complete the DMA 285. And then also you're going to ask them if they have a copy of their insurance, if they have their insurance card with them. If they do, please make a copy of it and send it along as part of your PE packet.
We have a question in the chat.
Yes, ma'am.
If the patient is under aunt, uncle, temporary legal custody, and the aunt or uncle has Blue Cross, do they have to complete the attachment A if they are not claiming the patient on their taxes?
Attachment A is for if they have other health insurance, whether it's up under their uncle, their aunt, their cousin, their brother, whoever has the other health insurance on them, that's information that has to be disclosed. So yes, they would need to fill out attachment A if that health insurance is through a job. If they just have health insurance, the uncle is just paying for it, but it's not through a job, then they still need to disclose that information, and then they would need to fill out the DMA 285. But yes, they have to disclose that information. If they don't know the information, they need to give us as much information as they can, and DFACS and HMS will dig down to further to get the policy information, everything that they need.
Okay, I just wanted to clarify on that question. Are you asking if the child is covered under, is the child covered under the Blue Cross Blue Shield, or is it just the aunt or uncle? Just the aunt and uncle are covered, not the child.
Is the aunt and uncle applying for a presumptive?
She said, yeah.
Then yes, it needs to be disclosed. But if the aunt or uncle is not applying and the cover is just for the aunt or uncle, then no. It's only for people that are applying for presumptive eligibility that has the other health insurance.
She said, thank you. We're clear in the chat.
Thank you. Okay, the next one is the notice of ADA section 504 rights, and this is just information for our applicants. So this information should be given a copy to each applicant, and a copy should also go in your PE packet. And this is also part of your audit process. So give one copy to each applicant. You don't have to give one to each individual in the household, just one per household, each applicant, and then one goes into the PE packet. Are there any questions over any of the forms that we went over so far? Hearing none, I guess not. So now we're going to talk about the PE manual update. Remember, I was telling you earlier with the P4HB, if they're active on P4HB, once you complete the PE process, then you need to complete a PE manual update form to let DCH know that that P4HB case needs to be terminated. So this is the process that we're going to talk about. So what is the PE manual update process? The PE manual update process comes into play when for whatever reason, maybe you're not able to add the PE to GAMIS, whether you have internet access or not, or either GAMIS is down. For whatever reason, you're not able to add the PE to GAMIS. If the P4HB needs to be terminated, if for some reason you mistakenly put the member in the wrong aid category after you hit submit and you realize, hey, I put this person in parent caretaker when they should have been in children under 19, or I put the person in parent caretaker, they should have been in former foster care. For whatever reason, you picked the wrong aid category and that needs to be updated. Or if any other member's information needs to be updated and you could not update it or you forgot to update it, then this is where you would need to fill out a PE manual update form. And this form is sent to DCH, and DCH will go into the GAMIS system and make those updates for you. So that's when the PE manual update comes into play. So what you're going to do is, if we go to the next slide, slide 37, this is what the PE manual update form looks like. And like I said, it was updated, and that's because right here, we added the word U.S. national. So in GAMIS, if an individual is a U.S. national, you're still going to put their citizenship as U.S. citizen. So even though, because we don't have U.S. national in the system yet, so you're still going to choose U.S. citizen if that comes into play. But this is what the form looks like. Of course, it tells you right here what to email it to. It tells you what to put in the subject line right here. So this is how you're going to fill out the form. Of course, you're going to put the date that you are completing this form. And then there are 3 options to check: pregnant women PE, hospital PE, and then the women's health PE. You're always going to check the middle box which says hospital PE. Even though this form, you may be completing this form because of a pregnant woman, do not check this box. This is for our other providers. So you're always going to check hospital PE. Right up under here, can somebody tell me what this says? Because believe it or not, we still get update forms without this. Can somebody tell me what this says? You can type it in the chat or you can take yourself off mute. I want to make sure everybody understands this right here.
632H.
That is correct. Attach the form 6328. So that means if you're sending this update form, you should have this 632H attached to it. Do not just send an email and say, hey, can you terminate the P4HB for this member? No, it's not just a regular email. It's an email with these attachments. So you need to have the update form along with the 632H. And then also over here in this yellow box, it says, if applicable, the attachment A and verification. And I'll talk about that in just a moment. But when you're sending this form, please make sure you are attaching a copy of the 632H. So down here, you're not going to complete this whole entire form. Because if you do, that means everything on that form needs to be updated in the system. And I'm not sure that that is particularly correct. So what you're going to do is only go down here and check the boxes or the fields that need to be updated. So for an example, if you see that the individual's first name is incorrect or something about the name is incorrect and you forgot to update it, then you're going to check the box right here where it says name, and then you're going to put the complete name over here. Even though it may be just the first name or the middle initial or whatever needs to be changed, just give me the whole entire name so we can make sure that the entire name is correct in the system. Same thing for address. If the address needs to be updated, check the box right here and put the complete address over here. It may be just the zip code that needs to be updated, or it may be just the name is misspelled, the street name is misspelled. Please go ahead and put the entire address on this particular field. I gave you some examples of what to complete based off of the situation, based off of the issue that's at hand. So for instance, for example 1, for the P4HB, if the P4HB needs to be terminated, after you put the date, after you check this box right here for hospital PE, you're going to go down to where it says terminate. It's supposed to be down here. I'm sorry. It's supposed to be down here. Terminate P4HB. You're going to check that box. Go down here, put your name, and put your telephone number. That's it. Hold on, y'all. Let me make that correction right quick. So it's supposed to be down here where it says terminate P4HB. So terminate P4HB, you're going to check the box where it says terminate P4HB, put your name, print your name, and print your telephone number, and that's it. You're not going to give us the name, address, social security number, date of birth, and all that. That's why you're sending us the 632H, because we would get the demographic information from the 632H. Example 2. If for some reason you're not able to add the information to GAMIS and it needs to be added by us, then you're going to check the box where it says add PE to GAMIS. It's circled right here in red. And then it's going to ask you, what is the PE period? Remember, give us the start date through the end date. Don't just give us the start date. Don't just give us the end date. Give us both dates. Put it right here. Another example with this one right here, you may get an error message that says pregnancy within the last 7 months, especially for a woman that's pregnant. She may have been pregnant before, and for some reason within 7 months, she's pregnant again. So if that's the case, that's the error message that you're going to get. And if you get that error message, you're not going to be able to add her PE to GAMIS. So in that situation, not only are you going to complete these 2 fields, you're also going to complete 2 more fields. So for that pregnant error message that you're getting, you're going to also complete the field right here where it says expected birth date of fetuses. That means you're going to give us the due date. And then also down here, you're going to give us the number of birth. You're going to complete that field as well. So if you get that error message, then those are the 4 fields that you complete. Expected birth date of fetuses, number of births, add PE to GAMIS, and the PE period. And the last example, if you mistakenly put someone in the wrong aid category and it needs to be updated, go down here where it says update PE aid category, check that box. And on this drop down box right here where it says correct PE aid category, you're going to choose what aid category that particular individual is supposed to be active in. And then you're going to print your name, put your telephone number after you have put the date, and then check this box right here. If you're doing an update, if you're doing an application over the phone and something needs to be updated, of course, you're going to find out in that process, the PE application is not going to be signed because the member is not there to sign with you. So you're going to be signing on their behalf. And if you're signing on their behalf, you're going to be using attachment A. So that's why attachment A says right here, if applicable. So if we don't see that attachment A along with the 632H in this update form, we're not going to update it. So if you do the application over the phone, please make sure you are attaching a copy of the attachment A. If for some reason the member's social security number, the date of birth, or the citizenship needs to be updated, then that is something that that DCH needs to verify, because we have to verify their identity to make sure that that is the correct social security number, date of birth, and citizenship for them. So if we have to update one of those fields, then you need to provide verification of that. Going back to the previous slide, this is everything that I just went over that sums it up for you of, what to send, what to put in the subject line. And it tells you if the name, date of birth, social security number, or citizenship needs to be updated to send proof of that. And when you're sending the PE manual update form, you're going to send that in a separate email from your PE packet, because sometimes we are receiving the PE manual update form in the same email as the PE packet. When you send us the PE packet, we are basically, putting that we received that packet and we're sending it on to DFAS to be processed. we're really not looking through the whole packet. So therefore, we may miss the PE manual update if it's not in a separate email. So that's why I want you all to put these in a separate email. So if you have to do an update form, you're going to do an email for the PE manual update, and then you're going to do a separate email that has your whole PE packet in it. So it's two separate emails you will have to do if a PE manual update is needed. The PE manual update process is for people that are approved for PE only. If they're already on full Medicaid, this is not for them. They need to report their changes to DFACS. We do not update information for people that are approved on full Medicaid. Are there any questions? The next one is the attachment A. So because of the COVID-19 pandemic, we're trying to keep you all safe, and we're also trying to keep the members safe. So we were able to come up with this telephonic signature process, meaning that you all have another option to take PE applications. The applicant no longer has to be in the office with you. You can take their application over the phone, meaning you can interview them over the phone. So if that's the case, then this is where the attachment A comes into play. The first page is your instructions. It tells you what exactly, step by step, exactly of what you need to do. Then it tells you after you have made a PE determination, whether they are approved or denied, then you need to be providing your applicant with specific information. Of course, what was the decision in writing, which is the 634H, either approval or denial. Then you need to give them a copy of the 5460. Even though you're keeping the signature page, which you're going to put either mail to applicant or email to applicant, you still have to send them the other pages. You're going to be sending them a copy of the ADA Section 504 rights, and then you're also going to be sending them a copy of the second page of this attachment A, where you're going to be signing on their behalf. So if you're doing the application over the phone, you're going to have to read these statements verbatim as they are listed to your applicant. Once you have read it, then you're going to read them this first question to ask them, do you understand and agree to these statements? And they have to say yes or no. If they say yes, you're going to check that box right here. You're going to skip this second question and go down here. You're going to print the applicant's name, put the date, print your name, and then you sign it. You're signing on their behalf. They're giving you permission to sign on their behalf. If you ask them this question and they say no, then you're going to check the box that says no. Then this is where the second question comes into play. You're going to say, should I cancel this application? Because without your authorization, we are not able to process your application. So you're basically giving them another try. Okay, are you sure? Do you want me to cancel this application? Because without you authorizing and agreeing to these statements, we cannot process your application. So that's the second time that we're going to have to get their consent. So if they say yes, this question right here should not be addressed. And we're seeing that people are checking this box right here for yes for the first question, and then they're coming down here checking yes too. This question should be skipped if they did agree to these statements. Once an individual has been approved for presumptive eligibility, then these are the resources that you need to be providing to them. One is the quick guide on presumptive eligibility. It's just telling them that they have been approved and that possibly their application to will be sent to DFACS for a final determination. And then once, if they've been approved by DFACS, then they should know within 10 days if they have any changes in their circumstances, they need to report it to DFACS. And then also, once they get approved for full Medicaid, they will be enrolled into one of our 3 CMOs. So we only have 3 CMOs now. So we have AmeriGroup, CareSource, or Peach State. So they will be enrolled into one of those 3 CMOs. Then after that time, they would have at least 90 days to change their CMOs if they would like to. Otherwise, after 90 days, they would have to wait till their next enrollment period. The next one is the booklet. So if you all don't have a copy of these booklets, I will let you know how you can order these. But if individual does not understand how Medicaid works in Georgia, this is a good resource for them. So if you don't have access to these booklets, then what you would need to do in order to get a copy of these booklets is that you're going to have to fill out a form and send it to Gainwell Technologies. So if you go to the GAMIS web portal, and the web address is www.mmis.georgia, spelled all the way out, .gov. And Teresa, if you don't mind typing that in the chat so they will have it, I would appreciate it. So you will go to that web address, and once you get on the web address, you don't have to sign in. At the top, you're going to click on provider information. Once you click on provider information, then you're going to click on forms for providers. And that link would also allow you to access all the forms that we just went over. It will allow you access to those forms as well. And on that particular website is the English and the Spanish version. Once you click on forms for providers, you're going to look for the form that says DMA 292. So you will open that up, print it out, fill it out, and put the quantities of booklets that you need, and you're going to mail it back to the address that is listed on that particular form. And Gainwell Technologies will send back your quantities of booklets. And the only thing that they don't do is they don't send to a PO box. So it has to be sent to a physical address. And they are free. You don't have to pay for them. They're free. The next information is Plenty for Healthy Babies. We don't have these brochures that we're able to print out at this moment. So I did provide you the actual copy of these in the training material. So you just have to continue to print off of what you received in your training material. So this is just Plenty for Healthy Babies information to let people know about the program, what it kind of covers, how they can be eligible, and if they want to apply just for Plenty for Healthy Babies, where they can apply and where they can send their application back to. They can apply with you all. If they want to apply for Plenty for Healthy Babies only, then you would just give them the 94A form. And on the top of that 94A form, just write P4HB. So that way, once DFACS get the application, they'll know that this member is just trying to apply for Plenty for Healthy Babies. And you can send that application to the PE Corrections email address. So we have one for new mothers, and then it's one for young women. Are there any questions over any of the forms that we just went over, or any of the information that you should be providing your applicant if they are approved? Are there any questions in the chat, Teresa?
No, ma'am.
Okay.
Hold on, just came in. Is the verbal consent form also valid of the full Medicaid application?
Yes, the verbal consent, the attachment A, it stands for the signature for everything that the member has to sign. So it's going to be that serves as their signature. And that way, that's why you have to send us a copy of that attachment A as part of your PE packet, because we send that to DFACS. So DFACS would know that this application was done over the phone, and this is how the signature was captured. So yes. Any other questions?
We are clear.
Thank you so much. So now we're going to get into the verification type, the budget groups, and the income. So for verification of the requirements for income, for residency, for the citizenship, immigration status, for pregnancy, we do not have to have proof of any of that. We're always going to accept their statement. Yes, we know everybody's not going to be truthful, but we still have to go by what they tell us. It's going to be up to DFACS once they make the full Medicaid eligibility determination to figure out the correct information. So whatever they tell you, whatever you ask them and whatever they tell you, that's exactly what you have to go by. So no verification is required for presumptive eligibility. So of course, they have to, like I said, be a U.S. citizen, U.S. national, qualified immigrant. They have to be a resident of Georgia. If they're applying for former foster care, remember they age out of the age of 18 or older and have not reached their 26th birthday. And also another thing about the former foster care that I forgot to mention is that they could have been in foster care in any state. It's not only limited to Georgia. And then they have to be the appropriate age. And what I mean by that is because Georgia is not a state that expanded Medicaid. If an individual is between the ages of 19 through 64, they're not pregnant, they don't have any children, and they're not blind or disabled, then basically there's no aid category that they would particularly fit in right now. So therefore, that's what I mean by the appropriate age. So they have to either be pregnant or have a child or be blind or disabled or be under the age of 19 in order for them to qualify for Medicaid in Georgia. So now we're going to talk about the citizenship immigration status. So on your particular application, there is a column that says U.S. citizen, U.S. national, or lawful present immigrant, and that has to be addressed for each person on that budget group. Whether that person wants Medicaid or not, it still has to be addressed for each individual person. And then on the sworn statement that you either read to your applicant if they're doing it over the phone, or either you can let them read it if they're there with you. They have to declare on the penalty of perjury that they are a U.S. citizen, U.S. national, or lawfully present immigrant, and that they certify that the information that they provided to you on that application is accurate and true about themselves, their residency, their tax status, all that information that they gave you is correct. And then, of course, they're going to date and sign it. If they don't sign it, and it's because of the attachment A that you have sent as part of your PE packet, that would serve as their signature. So this is the citizenship immigration status policy. So this is telling you if a person is not a U.S. citizen or a U.S. national. So that's the first thing that you will possibly, this is how I will interview. So if I have someone that is coming in to apply, the first thing I'm going to ask them, or not the first thing, but once you get to this question, you're going to ask them, are you a U.S. citizen or a U.S. national? If they say no, then that means that they have to meet an immigration status and they have to be considered a qualified immigrant in order to be eligible for Medicaid. So this policy right here is telling you how to determine if someone is considered a qualified immigrant. So the first, it says a qualified immigrant, they can qualify for Medicaid if they meet one of these categories right here, 1A, B, or C, and that's because they arrived in the United States before August 22nd, 1996. So if they arrived in the U.S. before this date, then they have to meet either 1A, B, or C. A is that they are a lawful permanent resident. B is they are a Somali refugee, Cuban Haitian entrants, immigrants granted parole for at least 1 year, immigrants whose deportation is being withheld, battered immigrants, or victims of severe form of trafficking. And then C is honorably discharged U.S. veterans or active duty military personnel. And then if it's not them that's an active duty military or U.S. veteran, then they can possibly qualify for Medicaid based off of their spouse or unmarried dependent children being a U.S. veteran or active duty military personnel. So those are the criteria if they came into the United States before August 22nd, 1996. If they came into the United States on or after August 22nd, 1996, then they're going to have to meet the criteria for number 2A, B, C, or D. So you have your lawful permanent residents that were here for 5 years or more. So that means if they came to the United States on and after August 22nd, 1996, they now have to meet the 5-year bar, meaning they have to have been in the United States before at least 5 years. B is the same as the first part, Somali refugee, Cuban Haitian interest, immigrants granted parole for at least 1 year. The deportations being with here battered immigrants or victims of severe form of trafficking. And then you have your lawful permanent residents with 40 qualifying quarters. That means that they have at least 10 years of employment under the Social Security system and that they have not received any federal means tested benefits. So if they have 40 qualifying quarters and they are a lawful permanent residents, then they can qualify based off of that. And then the 40 qualifying quarters, they can be met by their spouse or either their parent. So if they don't have it, but their spouse or their parent has 40 qualifying quarters and have not received any federal benefits, then they can possibly qualify off of their particular spouse or their parent. And then your honorably discharge you as veterans, active duty military personnel, their spouse or unmarried dependent children. And then also effective December of 2020, we have what we call COFA migrants. And these individuals, they are either from the federal states of Micronesia, the Republic of Marshall Islands, or the Republic of Palau. So these individuals are considered COFA migrants. So if they're COFA migrants and they're from one of these 3 islands, then they can be considered a qualified immigrant and they do not have to meet that 5-year bar. And that became, again, the COFA migrants became effective December of 2020. Are there any questions?
Yes, we have a couple of clarifications they're asking for in the chat. Xavier is saying that U.S. citizens are also considered to be U.S. nationals, and U.S. law defines a national as a person owing permanent allegiance to a state. And since U.S. citizens owe since U.S. citizens owe allegiance to the U.S., they are both U.S. citizens and nationals. However, it's possible to be a U.S. national but not a U.S. citizen. And then we also had a question for Jamie where she was asking, could you please give a blurb displaying the difference between a U.S. citizen and a U.S. national?
Yes, whoever put that information before Jamie's question, that is correct. U.S. citizens are considered U.S. national. In some limited situations, you can have people that are not U.S. citizens that are U.S. national. So you just have to ask which one they are, a U.S. citizen or a U.S. national. If they're not a U.S. citizen, then of course they could be a U.S. national. But in some limited circumstances, that means that they was born in the American Samoa or people abroad with one or more American Samoan parents. So you just have to ask. But right now in GAMIS, we only have the field for U.S. citizens. So right now, even though they may not be a U.S. citizen, but they are a U.S. national, you still just have to check the box for U.S. citizen. Are there any other questions? If no, we're going to continue on. I get this question a lot. Right now it kind of has died down because I put this out here. You may have someone that comes in and gives you their employment authorization document, or either you may notice it as an employment authorization card. So this particular verification is just verifying that non-US citizens are authorized to work in the United States. So this really does not verify or does not tell us about their immigration status. So if they give you this card, that's fine. Just make a copy of it and send it to DFACS. But not send it to DFACS, but put it in your packet so we can send it to DFACS. But if they give you this, you still need to question about their immigration status. So you will go through the policy that we just went over on the previous slide to see if they meet the qualified immigration status. So again, this does not clarify or verify their immigration status. You still have to ask about their immigration status. Now we're going to talk about the budget group. So this is going to determine who should all be on this application and what income limit we're going to look at, and also what income we're going to count. Now, just because there are, people in their household does not mean that all of those people are going to be a part of their budget group. To be a part of someone's budget group, they have to have a tax filer or non-tax filer relationship. So if they do, then they are going to be considered an individual that must be included in the budget group. And then if that individual or individuals have income that we include, that income is going to come along right with them. But if they are not a part of the budget group, that means that they should not be listed on the application. And then also their income is not going to count. So now we're going to look at the budget group flow chart. This is going to be a very good friend of yours because this determines or lets you know who should be included in the budget group or not. So if you don't see the individuals listed here, if the individual does not fit one of these criteria, then that person does not need to be a part of that budget group. So this is how you follow the flow chart. So you're always going to ask the individual, the applicant, do you expect to file taxes or expect to be claimed as a tax dependent? Based off of their answer to that question, then you're just going to follow the arrows, and you're either going to apply tax filer rules or you're going to apply non-filer rules, which is also considered non-tax filers. So if you ask that question, and the applicant says, yes, I expect to file taxes, then you're going to follow the arrow right here, this yes arrow that says, the first arrow that says yes, and it says apply tax filer rules. So for that tax filer, these are the only people that should be included in the budget group and listed on the application. So you're going to have, of course, the tax filer, him or herself, and then everyone that tax filer is expecting to claim as a tax dependent. So whoever that tax filer is claiming as a tax dependent, that individual needs to be listed in that budget group. If the tax filer is married and living with the spouse, that spouse must be included as well. So they have to be married and living together. And that's regardless if they file jointly or not. And then we always count the unborn fetuses. So if someone is pregnant, we always count the number of fetuses that that person is expecting. So that is for a tax filer if they are expecting to file taxes. If the individuals say no to the question, they do not expect to file taxes, they do not expect to be claimed as a tax dependent, then you're going to follow this arrow right here that says no, and we're going to apply non-filer rules or non-tax filer rules. And based off if the individual is an adult or a child, these are the people that should be included in their budget group. So for the adult, of course, it's going to be the adult, him or herself. If they are married and living with their spouse, the spouse needs to be included. If they have any children under the age of 19 living with them, those children need to be included. and that can be step, adoptive, or biological. And then also the unborn fetus or fetuses. If the individual is a child, then the child, him or herself, has to be included. If the child is living with his or her parents, those parents have to be included along with their income. Siblings under the age of 19, if living with them, those siblings need to be included. And then, of course, the unborn fetus or fetuses. So if an individual does not expect to file taxes or be claimed as a tax dependent, then you're going to apply the non-filer rules, and these are the individuals that should be included in their budget group. If the individual expects to be claimed as a tax dependent, then we're going to have to go through some exceptions to see if that tax dependent meets an exception, and whether they meet an exception or not, it's going to tell us whether we're going to apply tax filer rules or non-tax filer rules. So the first exception is the person expects to be claimed as a tax dependent by someone other than a parent or a spouse. So if someone else, like their uncle or their aunt, is claiming them, then that means that they do meet this exception. You're going to follow this arrow that says no, and it's pointing to the box that says non-filer rules. So you're going to apply non-filer rules. If the individual is under the age of 19, they're living with both parents, and the parents can be either married or unmarried, but they're not filing jointly. That means that they're filing separately. And one of the parents is claiming that tax dependent. So if that's the case, then the tax dependent meets this exception. And again, you're going to apply non-filer rules. The last one is the child is under the age of 19, expects to be claimed by a non-custodial parent. That means that that child is living with one parent, and then another parent that is living somewhere else is claiming that child as a tax dependent. Then that child meets that exception, and you're going to apply non-filer rules. If you go through these three exceptions, and the tax dependent does not meet either one of these exceptions, then you're going to follow the arrow that says no, and it's pointing to the box that says apply tax filer rules. And for the tax dependent, their budget group is going to be same as the person that is claiming them. So whoever the tax filer is, that tax filer has to be a part of the budget group. And then remember, whoever that tax filer is claiming, besides the tax, that one tax dependent, whoever else that tax filer is claiming, those individuals have to be included. If the tax filer is married and living with the spouse has to be included. And then, of course, unborn or unborn fetuses. So if you're not sure who should be a part of the budget group, please make sure you get this, keep a copy of this with you, and just go through the chart based off of once you ask them this question, based off of their answer, then it tells you whether you're going to apply tax filer rules or non-tax filer rules. Are there any questions over the budget group flow chart? And you do have a bigger copy of this in the training material email, so you can have a copy of this with you at all times. Okay, now we're going to talk about MAGI-based income. Remember, MAGI just stands for Modified Adjusted Gross Income. And like I said, majority of this income are taxable income that we use to in the PE assistance budget. And that can be like, earned income, Social Security benefits, tax-exempt interest, or foreign earned income. So if they have income that is MAGI-based income, we are going to include that income with them, with everybody that has income. And remember, earned income, of course, you receive that once you provide the service, then you are given compensation for the service that you did provide. And that can be in the form of wages, salaries, commission, or self-employment. One thing I do want to say about self-employment, for self-employment, we always have to ask the individual if they have any business expenses for that particular month. So if you have someone and they say that they are self-employed, once they give you the gross amount, then you're going to ask them if they had or have any business expenses that month. If they say yes, then you're going to subtract off, they're going to have to give you the amount of the expenses. You're going to subtract the expenses off of the gross amount. And then whatever that amount is, that's the amount that you're actually going to put on the application. So you're not going to really put the gross, we're really going to put the net for self-employment income. So you ask them if they have any business expenses. If they do, then you're going to subtract those business expenses off of their gross income amount. Now, with the other types of income, there are certain deductions that we can subtract off of their income before we calculate it all the way out and compare it to the income limit. So there are 3 types of deductions that we can allow in PE. We have your pre-tax deductions, your Form 1040 deductions, and your 5% deductions. So the first is, and this is for your information purposes only, is just showing you what, the pre-tax deduction can be like. So your pre-tax deduction, of course, are your deductions that you have taken out of your check before taxes are taken out. And those are usually in the form of like your full 1K, your dental insurance, your life insurance, vision insurance, things of that nature. So again, they don't have to show you this. You just ask them, do you have any pre-tax deductions taken out of your check? If they say yes, they just tell you what it is and the amount it is. 1040 deductions. This is, again, for your information purposes only. I wanted to show you this because you need to make sure you understand what is considered a 1040 deductions. So only the things listed here on this particular form, these are considered 1040 deductions. So if they say they had student loan interest deduction, they just tell you the amount and you can deduct it from their income. Moving expenses, but it's for members of the armed forces. They tell you that amount, you can subtract it. So if they can just tell you one of these expenses and tell you the amount, then you can subtract it off of their income as for a Form 1040 deduction. Now, beside alimony right here, if the only way we can allow this as a deduction is if the divorce or the separation was finalized or modified on or after we can allow it if the divorce or the separation was finalized or modified before January 1st, 2019. If the divorce or the separation was modified or finalized after this date, on or after this date, we can no longer allow it as a deduction. And then also we can no longer count it as income. So if it was finalized or modified before this date, yes, you can allow it as a deduction. And yes, you would, if somebody is receiving alimony, yes, you can count it as income. But on or after this date, we can no longer count it as income and we can no longer allow it as a deduction. Now, as far as the 5% deduction, that amount is already calculated for you and it is listed on your income limit chart. So it's going to be that second column right here that says 5% deduction. Now, unlike the 1040 deductions and the pre-tax deduction, if they have those deductions, we can go ahead and subtract it off of their income. If for the 5% deduction, we only subtract it off of their income if they are basically over the income limit and is needed to make them eligible. So let's say, for instance, we had a household or a budget group of 2. And let's say a mom and a child, she's coming in, she's applying, and she says that her income is $500 a month. And remember, these numbers are in a monthly form. We always go by a monthly amount. Let's say she said she makes $500 a month. So when you look at it, if you compare $500 to the income limit for parent caretaker, you see that the income limit is $457 a month. So that means she's over because she's making $500. So in that instance, what you're going to do is subtract $73 because this is the 5% deduction. If she doesn't have any pre-tax or 1040 deductions first, if she does, you would subtract those first. And if she's still over, that's when you come to the 5%. So in this instance, she didn't have any pre-tax or 1040 deductions. And so her $500 is making her over the income limit right now. But if we subtract that $73 from the 500, then they would possibly be eligible for parent caretaker. Let's say it's the same scenario, mom, child. Let's say now her income is $400. She's making $400. There's no pre-tax or 1040 deductions again. So in that instance, we're going to compare her $400 to this $457. She's under that limit. So therefore, we don't need to subtract that $73. So they're already eligible for parent caretaker without that 5%. So you only use the 5% deduction if it is needed to make them eligible, meaning that they're over the income limit. So this is your parent caretaker income limit. If you're looking at it for children under 19, then you're going to be looking at based off of their age. So there are 3 columns that you can look at. You have the 133% of the FPL, and that's for children age 6 through 19. You have the 149% of the FPL, which is children's 1 through 5. And then, of course, basically your newborns, the 205% of the FPL. And then your last column, the PGW, is for your pregnant women. And like I said, you don't see former foster care on here, so therefore we don't look at any income for former foster care. Are there any questions over the income or deductions or the budget group?
Rita, this is Olga. This form changes every year around April, no? We get a new form.
So
it's updated.
The new income limit is updated every year, and it possibly comes out between February and March of each year. But like this year, it was effective for March. We got the numbers like in January, February. So it was effective for March for you all to start using the new income limit. So yes, these numbers do change every year. And once we have the numbers available and the chart available, please make sure you be on the lookout for it between that time. I would say February, March, April. Between that time, be on the lookout for a new income limit chart. And thank you, Olga, for bringing that up, because that is another area where a lot of people are making their errors. They're still using, like we still have some people that are using 2020 limits. This chart has been effective since March 1st. So everybody should be using the 2021 limits. So please make sure you double check yourself when you get back to your office. It was included in your training material email that you have the correct income limit. Thank you for bringing that up, Olga.
Thank you, Kanita.
You're welcome. Are there any other questions? Okay, so for your income and for deductions, remember I told you the chart is in a monthly amount. So therefore we need to have the income in a monthly amount and the deductions in a monthly amount. So if the income and or deductions are not in a monthly amount, then you would need to what we call use a conversion factors to convert it over to a monthly amount. So based on how often they get that income or how often they pay those deductions, then you're going to use the correct conversion factors to convert it over to a monthly amount. So if someone is paid weekly, you're going to take that weekly amount and multiply it by 4.3333 and make sure you have 4 3s at the end of that decimal. 4.3333. So again, you take that weekly amount and multiply it by this conversion factor of 4.3333. You're not just going to multiply it by 4, because we have some people that are still doing that. Some people are still multiplying it by 4. No, In the real world, what we would normally do is multiply it by 4, but for Medicaid, we're going to multiply it by 4.3333. If the individual is paid bi-weekly, this is not twice a month, this is bi-weekly because a couple of months they may get a third check. So if they're paid every 2 weeks, you're going to multiply that bi-weekly amount times 2.1666. And there are 3 6s after the 1. 2.1666. If they're paid twice a month, just twice out of the month, then you're going to multiply that semi-monthly amount by 2. And then, of course, if they give you that yearly or annual amount, you just divide it by 12. Now, once you put that in your calculator to do, for instance, if an individual is paid $700 every 2 weeks, in my calculator, make sure you clear out your calculator each time because sometimes the numbers can get mixed up and all that. So make sure you're clearing out your calculator each time you're doing a calculation. So for an example, if an individual is paid $700 every 2 weeks, once I clear out my calculator, in my calculator, I'm going to put 700 times 2.1666. And whatever the calculator gives you, that is going to be their monthly amount. So in this instance, it came out to be $1,516.62. So that is what you're going to put as their monthly amount. If you had an individual that was paid, let's say $478 every week, $478 every week, I'm going to clear out my calculator. In my calculator, I'm going to put 478, and it's paid weekly, so I'm going to put it times 4.3333. Now, the calculator gives me 2071.3174. You're going to only take the first 2 numbers after the decimal point, and you're not going to round it. So in this instance, my amount should be $2,071.31. That's what you're going to put down. So that's going to be the monthly amount. So again, based on how often they get paid or how often they have those deductions taken out of their check or they pay the 1040 deduction, how often that is, then if it's not in a monthly amount already, use one of these conversions factors to convert it over to a monthly amount. Olga, since you're participating for me, can you read number 1, please?
An applicant works and earns $163 every 2 weeks. What is the monthly income?
Okay, so you have an applicant that works and earns $163 every 2 weeks. What is the monthly amount? So Olga, tell us exactly what we need to put in our calculator.
We need to multiply the 163 times 2.1666.
Okay, everybody heard her. She
That would-
told you in your calculator, put 163 times 2.1666. And what did you get, Olga?
And I got 353.15. Right?
That is correct. Right, that is correct. $353.15. You had, after the decimal point, it says 1558. So we're not going to count the other decimals, the other numbers. So we're only going to count the first 2 numbers after the decimal point. So your answer is none of these because it's not listed. It's $353.15. Any questions over number 1? Okay. Does anybody else have access to a mic? Raise your golden hand if you have access to a mic. Or if your mic is working. Okay, Rico, read number 2, please. And Pam, you'll read number 3.
An applicant receives workers' compensation benefits of $230 every 2 weeks. What is the monthly income? I'm gonna have to. That's gonna be the. You're gonna use the same formula for that one too as well.
Okay, read that again.
Okay.
Read that again for me.
Okay, an applicant received workers' compensation benefits of $230 every week. I'm sorry, yeah, every week. What is the monthly income? That's going to be 4.3333.
Okay, so in the calculator, make sure
Okay.
y'all clear it out.
Yeah.
Okay, tell us what to put again.
4.333.
So 230 times 4.3333. Remember, there are 4 3s after the decimal point.
Right.
So in your calculator, put 230 times 4.3333. And what did you get, Rico?
Okay, I didn't add it yet. I'm
Okay.
Whoever got it, they can. I mean, that's
No, we'll wait on you. No
okay.
problem.
All right. All right. 230. Amen. I'm using my phone, so
Okay, no
that's
problem.
230. 4.2. Okay. That's going to be 9965, and I do remember that we don't round off, so it's 999.65.
That is correct. Thank you so much.
B.
The answer is B, $996.65. Okay, Pam, can you read number 3, please?
An applicant pays $32 for dental insurance semi-monthly. What is the total monthly amount for the pre-tax deduction? And
Okay, Pam,
we're
tell
gonna
us
do
what it is.
32 times 2 because we're going to get a monthly amount for the 32 for the pre-tax deduction as well, which is going to be $64.
Thank you so much, Pam. That is correct. So the answer is $64. Semi-monthly, the conversion factor is just a multiplied by 2. So we're going to take that 32 and multiply it by 2. I hope that's pretty simple enough. So like I said, you just based off how often they are paid or how often the deductions are taken out or they pay the deductions, then make sure you use the correct conversion factor. Are there any questions over the conversion factors? Okay, so if you have an individual that has income, but every time they get paid, the income is not always the same. It fluctuates. It's different amounts. So this is the calculation that you will use if someone has income that fluctuates. So in the example that I give you, we have a person that was paid $115, $112, and $90. So what you're going to do if an applicant gives you those amounts, you're going to add those amounts up together. So in this scenario, that amount came out to be $317. Then you're going to take that $317 and you're going to divide by the number of pays that they gave you or received. So for this example, they gave us 3 pays. So we're going to divide that 317 by 3. Once we divide the 317 by 3, then we're going to get an average amount of $105.66. So every time they get paid, this is what their average in pay comes out to be. So this is not the monthly amount. This is just an average. Then we're going to take that average amount based on how often they are paid, and we're going to convert it over to a monthly amount. So if they're paid weekly, we will multiply it by 4.3333. Paid biweekly, multiplied by 2.1666. Semi-monthly, multiplied by 2, and monthly times 1. So again, add your numbers up together, then divide by the number of pays that they gave you, then take that average amount and convert it to a monthly amount based on how often they're paid. Okay, we're gonna go over a couple of examples. Lillian, I see your hand was raised. Can you read number 1, please? Is your mic working, Lillian, or did I not see it correctly? And does anybody else have access to a mic that can read number 1? If not, we'll start back over to the people that have access.
I'll read it.
Thank you.
Yeah, an applicant works and is paid every 2 weeks. Applicant was paid $493 and $499. What is the monthly income? Okay. All right, so let's see. Let me do this. Okay, so what I'm gonna do is add the 490, well, actually add the 493 and 499 and divide it by 2, and then do that as a monthly income, right?
That is correct. So let's take it step by step so everybody understand. So let's go ahead and add 493 plus 499 and stop at that point and tell me what you get, Rico.
Okay, with that I have 992.
That is correct. Everybody should have 992 when you just add those pays together. Okay, what's our next step? We're going to take that 992 and divide it by what?
Divided by 2, since we got 2 different amounts.
Okay, and what
Right.
that amount came out to be?
Okay, that's going to be 496.
496. So that's just our average. That's not our monthly right now. That's just an average. So every time this person got paid, it averaged it out to be 496 every 2 weeks. So this person is paid every 2 weeks. So what are we going to do with this $496?
Okay, the 496 will be time every 2 weeks will be times 2.1666. Is that
That
right?
is correct. And what is your answer?
Okay, the answer is going to be C. 1074.63.
Thank you so much, Rico. That is correct. The answer should be $1,074.63. Thank you for participating, Rico. Are there any questions over number 1? Okay, back to you, Olga. Can you read number 2, please?
An applicant works and paid monthly. Applicant was paid $1,225 and also $1,322. What is the monthly income?
Okay, tell us step by step what we need to do.
Okay, in this case, we added up the 2 amounts, the 1,225 plus the 1,322, and then we get the average. And then
Okay, so when we added the 1,225 plus the 1,322, what did you get, Olga?
okay, hold on a second. Let me get the number. I got 2,547.
Okay, so when everybody added those 2 pays together, you should have got 2,547. Okay, what's our next step, Olga?
What is the monthly amount?
No, what's our next step? Once we added the pays together, we got 2,547. What do we do next?
It's paid monthly. So you will take number 8. This is the correct answer.
Okay, we missing a step. We added the pays together. This is fluctuating income. Remember, this is fluctuating income. So every time this person was paid monthly.
I'm sorry. Yes.
No problem.
Divided by 2.
Yes.
Divided by 2.
That's
divided
correct.
by 2. And that's
So everybody should take
1,273.
Right, divided by 2. Remember, this is fluctuating income divided by 2. So you should get $1,273.50.
That's right.
Now what do we do? Or is there any other thing we need to do? I'm sorry, I couldn't hear you.
That will give us the total monthly income.
That is correct. That's already monthly income because if we multiply it by 1, we're just going to get the same thing. So your answer should be what?
1,273.
So is it A, B, C, or D?
I guess, did you around it? Is C?
You say C?
Mm-hmm.
Okay. Does anybody else have a different answer?
It should be D, none of these.
That is correct. Should be none of those. Remember, Olga said don't round. So if whatever the calculator gives you, that's what it is. And our amount came out to be $1,273.50. So even if we did round, we will round it up to $1,274, not $75. So you have to get what your calculator gives you. So it's $1,273.50.
C. Thank you.
Thank you so much for participating, Olga. I really appreciate it. And Pam, can you read number 3, please?
An applicant works and is paid weekly. Applicant was paid $500, $570, $585, and $600. What is the monthly income?
Okay, Pam, take us step by step of what we need to do.
We need to add $500, $570, $585, and $600 together. When we add those together, we get $2,255. And then we need to divide those by 4 to get a monthly average.
Okay.
And then, I'm sorry, a weekly average. And that's going to be $563.75. And then when we get that weekly average, we're going to multiply that by 4.3333 because he's paid weekly. And then that will give us our monthly average of $2,442.89, which is B.
Thank you so much, Pam. That is correct. $2,442.89. Okay, any questions over how we convert our income over to a monthly amount or either how we calculate when an income is fluctuating? So does everybody understand? Give me some thumbs up in the chat or take yourself on mute and say, I understand, or, let me know that you understand.
I understand.
Thank you.
I understand.
Thank you. And thank you for the ones that are participating in the chat.
Hello, can you hear me? No.
Yes.
Oh, awesome. I thought it wasn't working. Hi, Kunita, this is Sharon.
Okay.
I have a question. So, let's say somebody is paid weekly, but and he's being paid consistently every week. But for 1 month in particular, he wasn't paid 1 week because he got 0 because he couldn't work because he was at bedside with his child. In this case, I consider this to be actually 3 amounts, different amounts, because his income fluctuates. But then the 4th amount will be 0 because he didn't actually get paid that week. Would that be the case, or the average will be only the 3 weeks that he was paid? If that
Thank you
makes
so
sense.
much, Sharon. That is a great question. Thank you for asking that. So in that particular situation, you're going to have to ask that or either see if that particular income is a representative. So to me, that 0, that week that he didn't get paid because he was sick, he wasn't able to work, to me, that's not representative of what his income normally would be. Because if he was well or whatever, he possibly would be working. So in that instance, you would not count that check. You will only count the 3 checks that he gave you and divide it by 3. Does that answer your question, Sharon?
Yes, I believe it does. So because at some point I think I was calculating 0 because that would bring his income um, like higher income. But yes, I got your answer. So it'll be then 3 and not counting that week that he was at bedside. Thank you,
Right.
Canidia.
As long as
So
it's
the
not,
average, so
right.
the
As long
average
as
would
it's not.
be, so it would be the final amount would be divided by 3 instead of 4, correct?
That is correct, because that
Okay.
amount, that zeroed amount, is not representative of what he normally get.
Got it. Thank you.
You're welcome. Any other questions?
You have a couple of hand raised. I'm not quite sure if they had a question or they were just acknowledging something. But one
Okay.
is Shantae. Oh, she put her head down. And the other one is PE Medicaid guest.
Okay, the individuals that are locked up under PE Medicaid, if you have a question, let me know or type it in the chat. And you can let me know if they type it in the chat, Teresa.
Right. We don't have anything right now. I think their hands were just inadvertently raised.
Okay. Okay, so I hope you got that. It's pretty much simple, but you just have to make sure that you're using the correct conversion factors based on, how often they're paid or how often the deductions are done. But if you use the conversion factors, you won't have any issues at all. So there are certain types of income. We don't include all income. There are certain types of income that we do exclude. So if we do exclude that type of income, you're not going to put it on the 632H, the PE application. Because if you put it on the PE application, then you're going to try to include it as part of that budget when it should not be included. So if they have any type of income that is excludable income, we are not going to put it on the PE application. However, that application needs to be disclosed to DFAC. So they will put it on the 94A if they are completing the full Medicaid application. But for the 632H, the PE application, you will not list it there. But on the 94A, you need to make sure that they do disclose that income. They would disclose all income they have on the 94A. So this is just a list of some of the types of familiarized income that we do not include. This is not an all-inclusive list. This is just, some of the ones that we do exclude. And some of the examples are SSI, contributions, child support, veterans benefits, adoption assistance, disaster relief assistance. So if they have one of these types of income, remember, again, we're not going to put it on the 632H, but they do need to disclose it on the 94A. We do have some asterisks beside alimony and then the RSDI. Alimony, I've already told you about. Remember that if the divorce or the separation was finalized or modified on or after January 1st of 2019, we no longer count it as income. It will be exempt. But before that date, you will include it as income. RSDI of a tax dependent or child who has no other income and resides with a parent. So if you have a child that has RSDI income and they have no other income and they are staying with their parent, it is excluded. However, in times where they are meeting the IRS tax filing threshold, IRS sets a threshold each year for people that are required to file taxes. So if they don't meet that threshold amount, if they meet that threshold amount, meaning they're over that income amount or that threshold amount that IRS has set, then yes, that income will be included. Or if that child does not live with their parents and the parent is not claiming them as a tax dependent, then the RSDI will be included. And remember, when you're asking individuals about their income, if they tell you they get Social Security income, a lot of people don't really know the difference between the different types of income Social Security disperses out. because we have SSI, we have regular Social Security benefits, we have disability benefits, all of that. So you're just going to have to inquire a little bit more if they tell you they have Social Security income, because that need to determine what actual type of Social Security income they have to determine if it's included or not. Now, we have a policy manual, which is called Hospital Presumptive Eligibility Policy Manual, that is listed on the GAMIS web portal. Again, if you go onto the GAMIS web address and you click on provider information, this time you're going to click on, I think it's called provider manuals or provider, yeah, it's called provider manuals. If you click on that, once you click on that, you're going to look for the manual that's for hospital presumptive eligibility. Once you pull that manual up, if you go to Appendix I would give you a chart, a whole list of income that someone could receive, and it'll tell you whether that income is going to be included or excluded. So on that chart, it's going to give you the name, the type of income, the name of the income, and then in another column, it'll tell you I for included or E for excluded. Also, in parentheses beside the I or the E, you may see something that says Magi or non-Magi. Make sure it says Magi. You're looking for the parentheses that says Magi. If it doesn't have anything beside it, that means it's for Magi and non-Magi. So you can just take whether it's included or excluded. But if it says Magi or non-Magi, make sure you're looking at the ones that says Magi. Are there any questions? Okay, it's approximately 12:28. We're going to call it a stop it point right here, and we're going to pick back up after lunch. After lunch, we're going to go a little bit faster because I want to make sure I get you all out of here in time by 3:30, but I also want to make sure that we go thoroughly through our examples and how to fill out the PE application. With the examples, there are some PE applications we will be completing. The information has been provided to you if you printed out the PowerPoint, but if you think you need a bigger version when you come back from lunch, make sure you have 3 PE applications. You can print out pages 1 and 2, that's fine. You will need 1 PE manual update form and 1 attachment A. So if you don't want to use what's already provided to you in the PowerPoint, just print out a bigger versions of the PE application, a PE manual update, and the attachment A, and bring it back to you with you after lunch. So it's approximately 12:29. So please come back and we're going to start back up at 1 o'clock. And I'm going to stop the recording and we'll start it back once we come back. Enjoy your lunch.
Thank you.
You're welcome.
Thanks.